This lecture is going to briefly talk about considerations regarding assessment with school age. When considering a school setting, you do want to keep in mind the basics of assessment. Those things don't change, such as the complexity of the task you're asking, um, considerations with standardized assessments and tests, some of the cons, some of the pros and the drawbacks, and in addition to keeping in mind that criterion referenced assessments can also be very instrumental and informative in the school age population. But there are some other things that you also want to consider because part of your job as a speech pathologist in the school setting is to help children not only improve their speech and language skills but to access the curriculum. So, with that said, it's very critical to observe a school age child, in a variety of school settings. You want to know how the child is able to maintain compliance in a structured setting, such as a classroom, which is very different from a less structured setting, such as on the playground, in physical education classes, etc. And you're also looking at attention and being able to um, listen to the teacher's instructions, being able to sit, being able to focus. Those things are also very instrumental in being able to effectively learn in a classroom setting. And then you're also going to be looking at how the child interacts with his or her peers, how they interact with his or her teacher, and whether or not the student is overall organized. You know, looks like they know where to go to find this textbook, or if the teacher says pull out some paper and take notes, they look like they have a system in place. Also, whether or not the student is attentive, like I've mentioned before, or whether or not it looks like the student is frustrated in any of these settings. It's also important to get the student's point of view on the communication issue or academic problems or issues. So you're going to conduct a student interview. And as you're doing this, you can take into account or assess what their attitudes are toward listening and speaking. Do they come up with excuses for not hearing you correctly or answering correctly? And also, what's the child's learning style? Is this a child that is helped by visual prompts and also by visual supports? And what are the environmental and social factors that are at work in the child's life? Can you get a little bit of a sense about how well the child is liked by his or her peers, and whether or not the child has a supportive and good home environment? Another consideration that's a little bit different for older school age children is that we're now taking into account metalinguistics. And we want to make sure and take a look at whether or not the student has developed or is developing this skill. It starts to develop after the preschool years. And, again, metalinguistics is about making judgments regarding language, and it's really about being able to analyze and critique language. So those, higher skills when it comes to language, and you want to figure out if they understand messages that are not only about the content but also about how the message is transmitted. And this is a part of metalinguistics. Do they understand sarcasm, figurative speech and language, non-literal expressions? Those things do trip a lot of our children, or a lot of children up who have language disorders at the school age and level. Ad- Additionally, one of the important things, and we've talked about this already in assessment, general assessment principles, is you want to take a look at the child's narrative skills. This is a task or a skill that children are often asked to perform at the school age level. So it's a major part of the school experience. they're often telling personal and fictional narratives. And so you want to look at whether or not they've reached a point to where they can tell true narratives, whether or not you have sequential um, a sequential flow to the narrative, whether or not you have settings, plots, characters, whether or not the child is able to take the listener or audience into account when telling the narratives, making sure they supply enough of the details in order for the audience to be able to understand what's happening in the narratives. And that's coming at between 5 and 7 years of age. With 7 to 11 years of age, you want to look at whether or not children are able to summarize and categorize stories, whether or not they can tell you it's a fictional story or that sounds like a non-fictional story, that sounds like a story that you know is I'm trying to come up with the word, like a folk tale or folklore type of story. So, whether or not they're able to figure out, the general theme of narratives that they may come into contact with, and whether or not they can retell that story back to you. And then between 11 and 12 years of age, we expect that children are able to produce some pretty complex stories, which may have subplots and, a variety of things going on. So we look for that type of thing. Their stories should expand, and they definitely shouldn't have any issues with sequencing events and, providing plots and settings and characters and things like that. And then from 13 to 15 years of age, children or students should be able to analyze stories. They should be able to tell you the main idea of the story. They should be able to tell you some of the issues or the plot of a story. They should be able to break stories down in those sense, and you should be able to get a good summary from them of stories that they may read or come into contact with. And at this age, a lot of students are reading. These you're reading chapter books and books that are over 100, 200, 300 pages. They're reading things like Harry Potter, etc. So you want to be able to see whether or not they can recall the details and sequence and analyze it and things like that. And language samples can be instrumental in helping you to examine narrative abilities, because that is a question you can ask in a a language sample. Hey, have you ever read this book, or you ever read a Harry Potter book, or whatever that they may be familiar with? Can you tell me about one that you read? And so not only can you get a good language sample from the child, but you can also take a look at their narrative abilities at the same time. With school age children, you also want to take a look at their auditory processing skills. You want to try to determine if the child is having any issues with the detection of an auditory signal, um, the interpretation of auditory information, or categorization of sounds, whether they're having some type of issue with phonology, interpreting phonological information. Um, some children do have more difficulty with attention, especially if there is a lot of noise involved. So, you know, trying to figure out whether or not that child has more difficulty processing speech when there's a lot of noise around or noise involved, because some children have more difficulty than others. So when you're doing that, you're trying to determine if it's related to attentional deficits, whether or not the child knows how to attend to, um, s- you know, oral speech or conversational speech, and whether or not they know how to or show that they're able to attend to what's important about the speech signal. And then you want to or you may want to determine whether or not it's a combination of both, whether the child has both attentional deficits combined with language deficits that are impacting their auditory processing skills and abilities. One way to do that is to compare the performance on skills that only require using the auditory channel, or some non-language based assessment only, versus performance on tasks that require both, the either require the visual modality or language based tasks. So that way you can try to figure out, okay, um, is it that the child's not really good with language that's delivered through the auditory system. So, if I have the child do a language task that purely requires them to listen and respond, versus if I have them do a task where they don't necessarily have to listen and respond, but they can point to something, or read something and follow the instructions, etc. How do those two compare, and is it the same, or is it different? So that's another way you can try to compare pair skills. Try to isolate those different sensory systems. Auditory versus visual, and then do non-language based tasks versus language based tasks. So an example of more of a non-language based task, or a really low level language skills, may be something like the token task, or something like that, or listening to nonsense words. For children who have a specific language impairment, as we discussed earlier in the course, they frequently also have reading problems. So when you're testing children in the school age setting, it's very important and maybe very helpful, for the teachers, and for IEP meetings and talking to the parents and other professionals, if you incorporate a reading battery into testing. Because remember, we do know that oral language sets the foundation for reading. So one test you can consider is the Gray Oral Ready Assessment. And then also, a lot of kids with SLI typically have difficulty with form. So you want to examine their complex sentence use or their use of morphemes. Then you want to consider whether or not there are some comorbid diagnoses that are happening. Many children may have difficulty that require high levels of sustained attention, inhibition, working memory and planning, and organization. If they have a comorbid diagnosis of ADHD, and that may very well happen. So you want to make sure you talk to other professionals that may do this type of testing and rule that out, if you're working with a child, to see if they may also have difficulty with these type of skills as well.